Welcome to Doctors on Call. I'm Jenna Miller. Cough, fever, loss of taste and smell, and difficulty breathing are some common symptoms a person may experience with COVID-19. But anxiety, fear, loneliness, and stress are symptoms that many have felt this past year, regardless of whether or not a COVID test is actually positive. Mental health disorders, including anxiety and depression, can unfortunately worsen during this time. Today on Doctors on Call, we'll be discussing ways to improve our mental health during the pandemic and beyond with our guests, Cary Schwarz and Mark Dinkel from High Plains Mental Health Center.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from at Blue Cross Blue Shield of Kansas. We're committed to being a healthcare partner you can turn to. That's why we're simplifying the health insurance experience so you can feel more empowered in your health.
Russell Regional Hospital, experts, neighbors, friends.
Welcome back to Doctors on Call. Tonight we are discussing mental health. Cary Schwarz has worked for High Plains Mental Health Center for 23 years as an outpatient therapist and the last 6 years as a senior outpatient clinical supervisor. Her special areas of clinical focus include cognitive behavioral and mindfulness therapies with a focus on trauma-informed treatment. Mark Dinkel has worked with High Plains Mental Health Center for 17 years. He has spent much of that time serving children and families at Westside Alternative School in Hayes, before recently moving to the main office where he now works as an outpatient therapist and a senior clinical supervisor. Give us a call at 1-800-337-4788 toll-free with your medical questions about mental health on Doctors on Call. Our show brings you information which may be useful to you when you visit your own physician or therapist. Thank you both so much for joining us this evening. We have several important questions to cover this evening. First of all, let's talk about what is your approach to therapy.
Okay. Myself,
Yes.
I do a lot of cognitive behavioral therapy work, but I'm a little bit eclectic and kind of meet the needs of my individual clients, and so I also do a little DBT, dialectal behavioral therapy as well,
right.
As well as motivational interviewing and several others to a lesser extent, but primarily use CBT.
Sure. And what about you, Cary?
Yes, we do pretty similar. That we just know that those are evidence factors. Just we keep those, and again, we keep learning as we go and stuff that we add.
Now, do you typically see patients for long-term or short-term therapy?
For therapy, it really varies based on the needs of the client, of course. And so, we have some people that we see only for a few sessions, and then there's other people that have greater needs than that we might see much longer term than that, of course. And so,
Sure.
Lately I've been seeing more people just coming in for a few sessions with COVID going on and things. There's some people that are just not sure how to cope with things that are going on right now in our world, and so seems like, at least for myself in my practice, I've seen some people that have been a little shorter duration here recently.
Sure. And what advice do you give some of your clientele that don't really know how to cope during this time?
Oh, yes. The easy advice is just take a deep breath. But if you find yourself not being able to manage, please talk to a friend, a priest. One of us is mental health.
You hear of people bottling things inside and not really wanting to talk. How dangerous can that be?
Well, we always get concerned when people start to isolate, and so with the nature of the pandemic, people are isolating more. People haven't been able to see people for the holidays and things, and so it's been a disruption. And so we do see more people that are tending to bottle up their feelings lately, and so I think it's good for people to be checking in on friends and loved ones and reaching out and making sure that people aren't isolated.
How important is it to stay both physically and mentally healthy during these difficult times?
And I'm really think we cannot. So, make sure
There's also a lot of fear that's associated with the pandemic right now, unfortunately. How can a person turn that fear into something positive?
and that is nice.
Yes.
I enjoy answering that one because it's true. We know that anxiety and other kind of emotions can be very motivating. So if people turn that into kind of motivation, they're actually going to be able to end up behavior and doing.
Do you have anything?
No,
to add?
I think anxiety is a normal part of life, and so it's not always a bad thing, and so it can be a good motivator, and so we often tend to like to turn that into something more positive, and so I agree with Cary.
Now, about a year ago, they closed all the schools and everyone had to go home. Now a lot of, especially in our area, a lot of the school children are back in school, but some are still, at home. Maybe they chose to be home or they have to, they get quarantined. So how important is it to keep a structured schedule?
Yeah, routine's everything, and so I work more with kids than Cary does, but routine is everything for, I think, adults as well, but especially kids. And even though we kind of have returned to normal, there's some kids that I've worked with that have had to quarantine 3 times and have never had COVID themselves, but because they've been a close contact, and so lots of disruptions with school, and so causes additional stressors with school, and also keeping that routine. If you're not having to go to school, we find people tend to go to bed later, and so we're starting to stay up at night and starting to sleep more during the day and things, and so that routine just becomes very, very important. Yeah.
Sure, and unfortunately, it's a lot of times beyond their control, especially since you work with the children.
Sure.
How do you cope, or how do you deal with that anxiety, or how do you help your children clients to help with that anxiety of that, sometimes that back and forth?
Sure. And I personally like to do a lot of work with the family. And so when I'm working with youth, I tend to want the parents to be part of that process as well. And so I do quite a bit of family work to create the structure. Kids are not always going to make the best decisions as far as keeping schedule if they don't have to get up in the mornings and go to school and things. And so yeah, we do quite a bit of family work. And so that, we can maintain that structure and keep that structure in place for the kid.
And on the flip side, how do you help the parents, I guess, deal with that? Because if they're having to go to work and they've got kids at home, tell us how you help them through that.
And I think that's a very individual approach, kind of looking at what was the daily routine before all of this. We start being sometimes creative about to try to get them to do something here and now that's going to keep them all on a routine, including
Yeah.
Absolutely.
And it can be hard to get back to a routine, and so anytime there's a disruption in routine, sometimes we stop doing the things that were healthy for us before. So when you quarantine and then we go back, to normalcy, we don't always return and do all the things that we were doing before. Bad habits can develop and things, and so sometimes it's just helping families figure out what was working well before the disruption and getting back to that. So.
Sure. Now, what suggestions can you help or share to help with families to separate the work life from the school life to the family life? How do you help those families through that?
I read about a kind of cute technique, and I don't know how many of the young, mothers and fathers that we deal with know about this. It's called the Mr. Rogers technique. So just like when he walks in, he changes his sweater and he his shoes when he's going from one to another, that we kind of say that would be a good way to do it at home. Is if you're in school, have a kind of a place that is designated, and when you get to go to break, whatever recess might look like at home, that can be.
Excellent. Well, we can all relate to Mr. Rogers here at PBS.
That's true. Yes.
Let's talk about there's mostly mandates for masks in this area and around the country. But it can also be very stressful for some people too and cause anxiety. You hear of people that can have panic attacks and whatnot by wearing those masks. What would you say to those people?
And that's very individualized as well. With kids, it's actually went better than I probably expected when this all first started. Sometimes it's about finding the right material of mask, I know I had a client that I worked with. We practiced breathing through the mask, and we do it for short periods of time, and so that they could get comfortable and realize that that they are able to breathe. But particularly for younger kids, a lot of it seems to be more geared toward what kind of material. Is it a paper mask? Is it a cloth mask? And making sure that it fits properly is very important for kids. But finding fun designs and things to make it fun for kids is, of course, often very helpful in getting them to comply with that as well. But in talking to schools and things too, I think everybody's been kind of pleasantly surprised at how well kids have adapted to wearing masks. So.
And I believe that adults adapt better than I would have anticipated as well. I have just kind of talked about people, finding their masks, their accessories, their sunglasses, or their jewelry.
Is there a difference between physical distancing and emotional distancing?
I would say so.
Yes.
And I don't know that we have made that very clear, from the top down. We've used that social and people are so used to saying that's what we need to do. So I'm very happy people bring up other ways to think about this. Think of this physical, where we still have some time together, but we're just staying far enough apart. All those other it's a good thing to think.
Right.
Sure.
And what have you found are the psychological effects of being quarantined?
The isolation is the big one, and people that are already maybe prone to a little bit of anxiety and having that extra time, you don't have that sense of purpose, and you're just kind of shut down. You don't have as much socialization, as much distraction, so you're kind of alone with your thoughts. And so, having a good routine, again, comes back to that routine and having things to fill your day. Is alone and anxious with your thoughts is not always a good recipe. And so, for kids, it's certainly, the big thing is keeping them busy, finding alternative activities if that need be, but scheduling their days for them, not making sure they're not isolating in their rooms and things. So for me, it's the isolation is the big one.
And many individuals in nursing homes or retirement centers are not allowed company at this time, which is devastating. And what can we do to reach out to those people and to help this time a little bit easier for them?
And I think that's being creative as well. I mean, there was a time when families would write, send that kind of thing. And that generation is the generation that truly appreciates help, than younger.
Absolutely. Sure, great idea. Was it true that helping other people, whether it be sending a card to somebody, that a family member or somebody maybe you don't even know, but is it true that helping other people actually boosts your mental health?
Yes, very much so, and it's a regular part of what I do, and I'm sure it probably is for Cary as well. But yeah, sense of purpose again, living beyond oneself, we know is elevates mood, and so yes, it's a regular part of what I do in session. I'm sure Cary probably does as well. So yes, and there's plenty of need for that, as we talked about with nursing homes and things, but there's other people that have been isolated too. I mean, not just people in nursing homes, there's people that have been being safe and kind of choosing to stay home and things. And so I think everybody's got friends and relatives, if we're all honest and take a good appraisal, that we probably should be reaching out to more and looking out for. So.
Sure. Besides letters, you hear, a phone call, obviously, but even some of those residents don't even have a phone in their room. So what are some other ideas that they could maybe a family member could do to help reach out?
Oh, maybe the nurse had her some kind of a tablet help some of those video calls. There's using Skype still or Zoom or whatever format, but trying to I just think a little bit of the tech. People are willing to give that.
Absolutely. Now, can all the worry and the stress that people are dealing with, can that affect a person's physical health?
Yeah.
No doubt. I mean, we know, struggling with any kind of depression, anxiety, is most people probably are. But people that are having, it's almost like whatever your physical symptom is, if you add stress, it's going to.
And what should a person do
And
to
with,
help
and
with
with
that?
kids too, we see, stomach and digestive system issues with anxiety and things too. And I'm sorry, what? was your
No,
question?
that's great. I was just, I didn't know if you had any suggestions on how a person can deal with those.
Dealing with the physical symptoms.
Right,
Yes.
yeah.
Not bottle up feelings, increase socialization opportunities, making sure you're getting good exercise. Obviously, that schedule and routine that we've been talking about. All of those things are going to, help. If it's impacting your functioning, maybe having to, talk to a professional or and consider seeking professional help as well. And so where we kind of look at things is it start to interrupt with sleep? Does it start to interrupt with your ability to go to work or go to school? And those are kind of, does it impact relationships? Those are signs that we start to kind of look for to like, do we need to maybe get professional help at that point?
And if a person feels like maybe they do need professional help, but they're scared to reach out or they don't want anybody to think, something of them, what would you tell that person?
I hope they would, talk to someone that's start with and just having these, even maybe ask for reach help. That somebody else they know did.
Absolutely. We want to remind our viewers that we are talking about mental health tonight with Cary Schwarz and Mark Dinkel at High Plains Mental Health Center. If you want to give us a call, if you have a question for them regarding, we're talking about the pandemic, but we also are talking about mental health in general. So let's talk about turning to alcohol during this time. Maybe somebody has struggled with that in the past, or maybe they never have, and they're looking to do something like that to help ease the pain. What would you say to them?
We would certainly, hear them out, see what's in them, and really try to lean them toward what are those risks. We know that depression, there was less energy, enjoyment of, and we get to a point, alcohol, where it's a problem, because it's going to actually sedate. So some people, a little bit prone to depression, using alcohol.
And when we were talking about reaching out professionally, when might a person need to, if they feel like they just can't get themselves out of the place that they're in, that might be negative, when might be the clue that I need to reach out for professional help?
That kind of speaks to what I was saying earlier with, when it's impacting functioning, right? If it's getting in the way of, taking care of household chores, if it's getting in the way of your relationship with significant others, interference with work, school, sleep, changes in appetite, when it starts to impact functioning, that's usually where it's a pretty good idea. And if you come to see a professional and you don't need services, we would tell you that too, And so it never hurts if you feel like you need help to reach out to someone.
And how does a person go about finding a therapist that best suits them?
Hopefully what they do is, they talk about what the issues are, that have any history of getting help, and they thought this was the kind of individual that I know I by. They can certainly say, I need a Christian, for instance. I would like somebody who has children, is a close. But most of the I think that most professionals are pretty good at tuning into them, giving them some get.
Now, if you're set up with a therapist, we talk a lot on the show about second opinions, and you just don't click. What should a person do at that point?
I think you should have that discussion with your therapist. That can be hard for people sometimes, especially if they're dealing with anxiety. It can be difficult to talk to your therapist about that. But we're professionals. We don't get offended by those things, and we will help you find a good fit. Or sometimes just talking about what's not working, we can make it work. Between the therapist and the client at that point too. But certainly we can find a better fit for you. Certainly at High Plains we've got numerous therapists, and so if we can always find somebody that's going to be a good fit for you. And so speak up. I always say that the therapy sessions, it's for you. It's your time, it's your session. And so if it's not working for you, speak up and let us know.
Excellent advice. Now, what is the difference between a psychologist and a psychiatrist, or you hear counselor, therapist? What's the difference between all those terms?
So the psychiatrist is going to be a medical doctor, into medical school, and then they are the ones that are, as far as psychologists, there's different kinds of psychologists, but most of them around here are going to be very similar to counselors. There's usually a master clinician.
And at what point should a person seek out mental health through prescription drugs?
Well, that's always it's always a topic of conversation. Yes, there's some people that are more prone to want to seek medication services only. Some people want to stay away from medications, and so personal preference is part of that discussion. But what we recommend is a good discussion about that with a therapist, and make that decision together. And so that's a very individualized sort of decision to be made. And so I don't know, Cary, if you have more to add, but
Sure.
but it's a very individualized sort of choice.
We're more and more starting to use it, and these are usually like some kind of a questionnaire that comes up, or at the end that here's kind of your risk. So when we administer these, moderate, severe amount, and we're going to.
What do you find are some of the things that a person maybe just needs to accept that they can't change, that they can't control during the pandemic?
Quite a bit, actually. Yes, yeah. I think we're all done with, would rather be done with masks and be able to return to normal. And so, often in therapy we're focusing on the, accepting the things that we can't control, right? And refocusing our efforts on the things that are still in our control. It's just acknowledging and radically accepting, the things that are beyond our control can be kind of freeing once we can kind of sit there and let those things go, that those things are not in our control, and refocus on the things that are in our control and power. Yeah.
We hear the words depression, or a person is depressed. When is a person truly considered depressed?
So we would call it clinic, and it's going to be when they meet certain criteria. So there's 9 different, if you meet at least 2-week period, and they're starting to have that functioning in there, like Mark earlier. That it's gotten to a point where we're going to.
And if a person is having so far as having suicidal thoughts, or knows of someone who is having suicidal thoughts, what should they do?
Immediately, yes.
Absolutely.
And if they don't feel like they can, do they need to reach out to just somebody? They don't need to keep that inside?
Yes, yes.
Absolutely.
Reach out to someone, and for kids, that's really important. In schools and things, reach out to a teacher, counselor at school, a parent, let somebody know.
And if a loved one suspects that their loved one is struggling with mental illness, what should they do?
Hope they have I'm going to be here with. I'm going to, if you need to go get help,
Yeah, and I think it's important when you're having that conversation too to normalize. Anxiety is normal. To feel depressed sometimes is normal. And so the more that we can kind of normalize those feelings, the more people might be comfortable with reaching out and getting some help too.
We're just about ready to wrap up here, but real quick, what is a point of contact that if a person out there is struggling, needs to contact High Plains, where can they get a hold of you guys?
Yes, well, we have a website, of course. We have, presence in phone book, online if you need to Google it. But the number is 1-800. I'm going to forget it.
I don't know the 800 number.
Right, I'm forgetting it right.
There's no long distance
so it's
anymore anyway.
785-628-2871.
Yep.
Okay.
Yep, I stopped giving out the 800 because long distance isn't an issue for people.
Excellent. Okay, well, thank you both to Cary Schwarz and Mark Dinkel from High Plains Mental Health Center. On our next Doctors on Call, we'll be discussing orthopedics and podiatry. You can email questions for our next program at doctors@shptb.org. Thank you for joining us. For Doctors on Call, I'm Jenna Miller.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from At Blue Cross Blue Shield of Kansas. We're committed to being a healthcare partner you can turn to. That's why we're simplifying the health insurance experience so you can feel more empowered in your health.
Roxo Regional Hospital. Experts, neighbors, friends.